Welcome to the Summit School District Spotlight. My name is Mikki Grebetz and I am the Communications Coordinator for the school district, and today we'll be talking about general student health as well as social emotional learning. Stay with us. Welcome back. Again, my name is Mikki Grebetz, Communications Coordinator for the Summit School District, and today we'll be talking about student health and social emotional learning. Today I'm joined with Ellen Clark, Director of Special Services, and Elizabeth Edgar, our Physical and Mental Health Coordinator for the Summit School District. Thank you guys for being here. I really appreciate it.
Yeah, thank you for having us.
So this month is Bullying Prevention and Conflict Resolution Month in Summit School District. And one big piece of that is which we teach through our curriculum is social emotional learning. Mm-hmm. And I don't know if a lot of people out there know what social emotional learning is. Can you guys give us a quick overview of what is that?
Sure. Yeah, so social emotional learning, it's a big buzzword in education right now, but basically like the essence of what social emotional learning is about, it's helping students to develop the skills they need to be able to work independently and also in groups. So things like self-management, conflict resolution, relationship skills, that kind of thing is what social emotional learning is all about.
Great. Why is that so important for students to learn in school?
Well, I think at a very basic level, it's foundational to all other learning. If kids go to school and they don't feel connected to their peers and they don't feel like they have the skills to sit in class and engage, then they're not going to be very successful in any academic area. So it's really kind of a foundational piece that we want all of our students to have. So really preschool up to 12th grade, these are important skills we want all of our students to take away when they graduate from Summit School District.
Mm-hmm. And so you mentioned that students are learning this as well as their academic successes. And so that's part of Summit School District mission is for both academic and character or social emotional successes.
Yeah.
And so what are we doing in the classroom with curriculums to support social emotional learning? What are the curriculums we're using?
Well, at the preschool level, we use Incredible Years, and parents might know that as Dinosaur School. And then kindergarten through 5th grade, we're using a curriculum called Second Steps, and that actually also continues into the middle school. So again, 6th through 8th grade, they're using Second Steps. Snowy Peaks is using a curriculum called Discovery. And then when we get to the high school level, it looks a little bit different in that a lot of this social emotional work is infused in health classes throughout the contents, and also a big focus of advisory lessons that students receive.
That's really great. So at the school level, all students are receiving it every day in their classrooms. Overall, the umbrella of the district is our strategic master plan, Vision 2020. And one of the pillars of that is developing caring learners, which we're really trying to emphasize this year, as well as everything we work on. But this year we had a professional development day for staff to solely focus on that developing caring learners piece. What are some of the other things that we're doing?
So the Develop Caring Learners framework really focuses on 4 different priorities in that framework. And one of them is really the social emotional learning piece, which is one of our components, which is teach competencies, skills, and expectations. We also know that when we're teaching these skills, we also need to have other things as a part of our environment, which are things like a positive and safe school culture, making sure that we have equitable and culturally responsive practices in our school communities, and then also that we have a level of a continuum of supports. So we have supports like Elizabeth described that all students get, but then we also have supports that some students are able to access, and then also a level of intensive support for students that need more social and emotional learning and support.
That's great. And I know you're a part of a lot of different committees to support this work at schools. One of them is called MLT or Mts S Leadership Team. What is Mts S and what do you guys do?
So the Mts S Leadership Team, so Mts S stands for Multi-Tiered Systems of Support, and it's basically a framework where we make sure that everything that we're doing, we're infusing support at all levels, and then also things like family and community involvement, etc. And our Mts S Leadership Team, which is composed of a lot of district leadership members, but then also we have representation of principals and coordinators, and the superintendent's also a part of that. We have really been focused on this Develop Caring Learners framework. And so we have put together, like you mentioned, the Develop Caring Learners PD Day to make sure that our teachers feel supported and have the skills that they need to be able to do this in their classrooms. Because when you think about, social emotional learning, well, I've been focused on teaching math. So we want to make sure that we're providing all of our teachers with the support that they need to be able to do this on a daily basis with our kids, because we know it is so important.
Yeah.
And there's kind of two parts to that, because there's the curriculum piece, which is sort of that intentional scope and sequence of teaching skills. But the other piece, where you see it throughout the day, is just kind of those opportunities that present themselves. So if a couple students are having a disagreement, the teacher can step in, and when they help problem solve or help kind of coach the students on kind of how to proceed, that is a component of social emotional learning. So in some ways, we're just being a lot more intentional about those pieces, so that staff kind of understand what it is and expectations, and students are getting that consistent support, whether they're in math class, science, out at recess. So really trying to build a culture that really can articulate what those social emotional skills are, and then how does that play into a school day.
Yeah, you mentioned how people can respond to situations occurring between peers. And it is important to note that bullying and conflict and just being mean or rude are all very different, and they have different strategies to deal with those. And our teachers have gone through training how to identify and responses and strategies to deal with each one of those situations.
Right.
And we're also teaching our students in our curriculums and social emotional learning also how to do that, and also how to be an active upstander or bystander, and to support those involved in those kind of situations.
Yeah.
Another piece of the Develop Caring Learners framework that I think parents have likely heard a lot about from their schools is Pbis. So positive behavioral interventions and supports is what that stands for, and that's a whole piece of this that is across all of the components, that we teach students how to be, like Elizabeth was saying, ready to learn and a student, and then we reward that, because we know that that's not always internalized, and we want to make sure that we are recognizing when students are showing positive behaviors in school. And so that's a really big school culture thing that we are teaching, but then also rewarding positive behaviors in school. And that's also preschool through 12th grade, and of course looks different depending on the grade level, but is another big piece, and has been an initiative as a part of the Develop Caring Learners.
Which is great, to develop that safe and positive school culture.
Exactly.
And all of those things, having a safe place to go, that positive school culture, these social emotional skills, there's a lot of research that backs up that if those are in place and done well, academics increase. And that makes sense, right? Because if kids want to go to school, feel like they belong, feel safe, their brains are going to be in a place that they're ready to learn when they get there, and they're not worried about whatever drama might be going on with friends, or and not that there won't be any drama in school, but if they're feeling like I'm in a safe place, my teacher knows what to do, there's expectations of my peers, they're just going to be in a better place to be able to sit down and learn.
Great point on that, how to increase academic achievement as well with this.
Right.
So Summit School District doesn't compartmentalize social emotional learning versus any of the other health aspects of students. It's kind of all intertwined, which is really great that it all kind of works together to support our students in all health, whether it's physical, behavioral, mental. What are some of the other hot topics about student health right now? I know there's suicide prevention, substance, healthy kids.
Yeah.
What other kind of things is the school district doing this year or addressing?
Well, there's a lot going on throughout the district and at the different schools. And even with my title, physical and mental health coordinator, it's really hard to split those apart because we know so much of students' health, is intertwined between that mental and physical health. So, we want to make sure our kids are having breakfast before they get to school, and then we want them to feel safe when they're at school. So it's really hard to split those apart. So other initiatives, and you mentioned some of the big ones, is suicide prevention outreach. So how do we support students, particularly at the middle school and high school level, if they're concerned about their friends or they're not feeling like they're in a good place? How do we make sure we can connect them to resources? So we work closely with the school-based health center, which is part of the care clinic. Our counselors have been through a lot of training recently, just how do we support staff and parents in sort of identifying red flags if we see those. Substance abuse, I would say, again, it's kind of a continuum, right? At the elementary school level, we're really focusing on health skills around different situations that aren't dependent necessarily on having alcohol around or cigarettes, but how do you make healthy choices and advocate for yourself? So as the students get older and they find themselves in those situations, hopefully, you don't just get to middle school and all of a sudden you have to deal with whether or not you want to partake in experimentation. So again, it looks different, like what Ellen was saying, at the different grade levels, but when we get into middle school and high school, in our health classes, it's much more explicit in terms of substance abuse. What are the impacts? So whether it's drinking, marijuana use, there's a lot of talk now about vaping, and how do we make sure our students know that it's not okay and it's not safe, because that is kind of the new one that's come up. So, making sure staff has information, parents have information, and students. So again, health class, I think those advisories are really important. And then just communication that you do. Making sure information goes out to our parents so they're informed of kind of those big hot topics and what to look for. We're doing a lot. I feel like there's just a lot under that health umbrella, and I think that's pretty reflective of what's going on nationally. Suicide prevention, substance abuse, those are not unique to Summit County, especially the vaping thing. That is across the country, people are kind of struggling with, oh my gosh, how do we address this and quickly, because it happens so quickly. So I think mental health and substance abuse are really tied together, because we see that kind of manifest differently when kids get older versus when they're young, like preschool, elementary school. We see a lot of those challenges happen, or kids expressing that through behaviors that we're not wanting to see. And then when they get a little bit older, we see that again with kind of that risk-taking behavior. So I think, in short, what we're trying to do is have a continuum of supports, preschool through 12th, but it's going to look different at the different grade levels, and how we kind of approach it with students and with parents and staff.
And you had mentioned, we're not only doing this by ourselves at Summit School District. It's a community-wide initiative. It affects everybody in our community. And I know at the high school they take healthy choice classes. What are some of the other partnerships that we have to support our students at school as well as out in the community?
So I think in Summit County, we're really fortunate that there's really good relationships between the school district and different community partners. And there are a lot of resources in Summit County that you might not find in other rural resort areas. But we work closely with Summit County Public Health and Youth and Family Departments. We work, again, with the care clinic and the school-based health centers that are available in the district. from a mental health perspective, we've been doing a lot of work with building hope and making sure counselors and even teachers know how to navigate the mental health system in Summit County, how to find a counselor, how to access scholarships if they need it to support counseling services. We're working closely too with just like law enforcement and you know, if things bubble up, wanting to be in good communication so we're able to support those kids and their families. We work with FERC, so the Family and Intercultural Resource Center. We've worked closely with them on a lot of parenting classes. They've been doing a lot of outreach and classes. Again, you'll see the term social emotional learning and how parents can really work at home on supporting those skills with their kids. Early childhood options we work closely with, and the Head Start program that's in the preschools at the school district. So there are a lot of players in Summit County that are really working and invested in the health of our students and really recognize the importance of both physical and mental health. And I didn't even list all the physical health. I mean, there's so many clubs and outdoor activities and nonprofits that work to promote physical activity with our kids in Summit County.
Yeah, it's really great to have all these resources and a really great community to support the health and wellness of all of our kids, which is really great, and everyone in the county. How do we know how well we're doing with all these initiatives and all these groups and partnerships that we have? How do we know how well we're doing with substance prevention or connectedness with schools? I know we do some surveys.
Yeah, no, that's a really great question because that is something we're trying to make sure we capture to see like what's working and what's not. Healthy Kids Colorado Survey is a statewide initiative, and that gives us local data. Kids at the middle school and the high school are surveyed once every 2 years on some important health topics. So we have that data. For our elementary school students, we do some climate surveys to hear from parents and students about how they're feeling, and there's specific questions around bullying and you know, trying to gauge, do kids know where to go? Do parents feel like their kids are safe? So that we can see if we're trending in the right direction or not. And then
we're piloting something that's called Panorama, but basically it's our middle school and then 2 5th grade elementary schools are completing it's a student perception survey. So the students are really rating themselves on the social and emotional competencies that we're teaching them. And the questions are really based on what the student's perspective. So it asks the student, I can pay attention in class for more than X amount of minutes or something, depending on the grade level. So we're really getting information from the kids and what they're saying about their growth in being able to learn those skills. So we're piloting that right now, but we're really excited about that to see how that works, and considering having all schools and possibly all grades, maybe 3rd grade and up, being able to complete those surveys to help us know how well we're doing in social emotional. We also use, we have a data system for when students go to the office if they get in trouble with something. And teams look at that very frequently to see, oh, this student has struggled with the same thing a few times. We need to put supports in place. And schools have really looked at that at the student level and then also school level. Oh, we're having a big problem with technology violations or something like that, and we need to make sure that we're addressing that school-wide. So that's another way that we kind of globally can look at if we're decreasing behaviors and some of those externalizing behaviors that students exhibit. So those are a couple other things that we use. And then ultimately, we want to look at larger student outcomes like attendance or truancy, and those are things that we want to make sure we're improving. Like Elizabeth said, if we have a positive and safe environments, kids are more connected to school, and so we want to see things like attendance increase as well.
And it's really great to know that the district is using research-based and data-driven
Exactly.
decisions to make decisions for the district-wide and how to best support these kids. We were talking about the school district can't do it alone. You know, we do need additional funding from different places, and we have written grants. I know we're currently have the Kaiser grants as well as the school professional health grant. Can you talk about either of those and what we're using those funds for?
Sure. So we have two pretty big health-related grants right now in the school district. One is through Kaiser Permanente. It's a Thriving School grant, and really the focus is social-emotional learning. And I would say, in conjunction with that, looking at school climate, things that Ellen said, looking at how schools can be trauma-informed, and then also looking at staff well-being, because we know staff, I mean, teaching is a really stressful job, and so if we want our kids to feel safe and healthy, we want our teaching staff to feel healthy and safe as well. So that the Kaiser grant is specifically working with Upper Blue Elementary, Dillon Valley Elementary, and Silverthorne. And we're in our last year of a 3-year grant with them. And really the idea there was to sort of experiment with those schools and figure out like what is most effective and what really is, like you were saying with the data, what is moving the needle and what's not, so that we can expand that out to the other elementary schools and the district. The other grant is through CDE, so the Colorado Department of Education. It's a school health professional grant, and we actually had that grant the last 3 years, and it helped us to employ a social worker who was working at the secondary level, and she started some of the suicide prevention programming, and then also a program called Teen Intervene. So if a student, if adults are concerned about a student using substances and or if they get caught using some substances, they can be referred to Teen Intervene, and she will meet with the student 3 times to provide some education and some support in changing those behaviors or that usage. So that grant ended and we rewrote, and so we have that grant again for another 3 years. And this go around, our focus is more at the elementary school level. Although we still have kind of a K-12 perspective with that grant, we still have our social worker part-time, and we were able to hire a district counselor to help provide some additional support at the elementary schools, again around that teacher well-being and support. Because one thing with the social-emotional learning that is really kind of key is helping the adults with their social-emotional learning capacity. So one, the training piece, how do you teach these skills, but then also as an adult, and we can all probably use more of this, how are we doing with those skills, and how are we doing in terms of taking care of ourselves, so that we're in a good place to be present for students as well. So those are 2 big ones.
That's really great. Thank you both for being here and supporting our students and staff with their social emotional learning and really caring about the whole child. And just thank you both for being here today, and thank you all for joining us today and learning about what we're doing at the school district with social emotional health, as well as physical and behavioral health and mental health with all of our students and staff. And if you would like to learn more, please visit our website, summitk12.org. Thank you.